Hello, my name is Nikki. I'm going to be doing an IV insertion for BSN 246. To begin, I'm going to check MD orders, make sure that I have an order in place and that it's for the right patient. Doctor has ordered an IV to be placed for a blood transfusion. I'm going to gather my supplies, which is going to be the IV line, normal saline flush, the IV starter kit. I'm going to be using an 18 gauge needle, which is an appropriate size for the blood transfusion, and of course gloves and a sharps container. I'll start by entering the room. Knock, knock, knock. Hello, my name is Nikki. I'm the nurse. Can I come in? Patient invites me in. I'll close the door behind me. I'm going to perform hand hygiene. I'm going to put on my gloves. I'm going to ask the patient their name and date of birth. It's John Smith, September 17th, 1996. It looks the same on his ID band. Mr. Smith, do you have any allergies? He doesn't have any known allergies. And then I'm going to explain the procedure. Mr. Smith, doctor has ordered a blood transfusion. I'm going to go ahead and start your IV. Do you have any more questions? He says no, so I'm going to go ahead and start. I'm going to start with my IV line. I'm going to prime this, making sure that there are no air bubbles. Okay, and it's all primed. I'll leave this to the side. Next, I'm going to go ahead and make sure the skin looks okay. There's that this is an okay area to start an IV, and it looks fine. I'm going to go ahead and put on my tourniquet 4 to 6 inches above the insertion site, and I'm going to tie this tight with a quick release, but not too tight. And then I'm going to go ahead and check for peripheral pulse, which I feel. After that, I'm going to take my alcohol wipe and I'm going to start in circular motions and go outward for about 30 or so seconds. And then we'll let that area dry. I'm going to grab my 18 gauge needle. I'm going to make sure that when I'm inserting the needle that the bevel is up. So once the bevel is up, I'm going to go ahead and anchor the vein and then insert at a 30 to 45 degree angle. And when I see a flash of blood, I'll go ahead and start going flatter. Here we go. Go in, there's a flash of blood, so I'm going to go ahead and go flat and go about a 1/4 inch more, and then I'm going to insert the catheter while pulling the needle out. Once the needle is out, I'm going to anchor this with my non-dominant hand, retract the needle, and put this in my sharps container. Now that this is anchored, I'm going to go ahead and release the tourniquet, and I'm going to flush with the normal saline. So I'm going to attach this to the catheter here, making sure that the catheter does not move. I'm going to aspirate for the blood, which is there. We have blood return, and I'm going to slowly inject the normal saline. So injecting the normal saline, looking for any pain that the patient might be feeling or any infiltration that is going on. So this is flushed now. I'm going to go ahead and clamp the line and discontinue the normal saline flush. Now that this is discontinued, I'm going to grab my tegaderm and I'm going to be putting this over the catheter, making sure I don't cover the port. And I will remove the outer casing, the paper of the tegaderm. I'm also going to tape the line up so it is not in the patient's way. And then I'm going to go ahead and label. So I'm going to put my initials, the date and time, and the gauge size I used, which is 18 gauge. And I'm going to put this at the top of the tegaderm, not covering the insertion site. Everything looks okay, so I'm going to clean up my space. I'm going to remove my gloves, ask the patient if they have any more questions. If they don't have any more questions, I'm going to perform hand hygiene once I have my gloves off, and then I will go and document where I placed the IV, the size gauge I used, how the resident or patient tolerated the procedure, and if there was any complaints or concerns. Some time goes by. Doctor has now ordered to discontinue the IV. Of course, this would be part of my cleanup to remove the whole tourniquet. So doctor has discontinued the IV now. So I will go ahead and knock on the door. Knock, knock. Hi, my name is Nikki. I'm your nurse. May I come in? Patient invites me in. I'll close the door behind me. Perform hand hygiene. And put on my gloves. For this, I will just need a couple pieces of gauze and some tape. And then I'm just going to go ahead and double confirm the patient's name, John Smith, September 17th, 1996. It's the same person, and I will explain the procedure. Now that you've got your transfusion, I'm going to discontinue your IV. Do you have any questions? Patient does not have any questions, so I'm going to start by removing the dressings and then removing the catheter. For this, we want to be careful that we're mindful of the patient's skin and not pulling the skin while we pull off the tegaderm, and making sure we don't take the catheter with the tegaderm when we are pulling this off. I'm going to take one of my pieces of gauze. I'm going to hold it over the insertion site while I quickly remove the catheter. I will check the catheter to make sure that there are no missing pieces and the catheter is still intact, which it is. I will throw this in my sharps container. I'm going to hold this gauze here for 30 seconds to make sure that the area clots. It's been 30 seconds. I'm going to grab my next piece of gauze, throw this one away, and then with this piece of gauze, I'm going to put it over the insertion site and cover with a piece of tape. After that, the procedure is done. I'm going to ask the patient if they have any other questions, which they don't have any other questions. I'm going to remove my gloves, perform hand hygiene, exit the room, and document that I removed the IV catheter and that the catheter was intact when I removed it.